I'm here to kind of talk about, understanding mental health conditions. I know as we are Nigerians, our parents, my mom, every time I told her she complained about her knee pain. And I'm like, Mommy, you're 60 something, that should be arthritis. She's like, no, my great grandmother never had arthritis. My mom's mom didn't have arthritis, so this is not arthritis. So I'm like, okay, we're going to go with that. But we thank God that we're in a community that the pastor, has brought awareness into the church, that we can all work in partnership to get to the bottom of what is going on. So we're going to talk about, mental health and their conditions. I will talk about depression, anxiety, grief, addiction, and also how we can support each other, how the church comes in and support. With medication, I always say medication is like training wheels when we're learning how to ride the bicycle. We have that training wheels on to kind of help us balance. And as soon as we're able to balance on our own, we're able to take away medication and we're able to thrive. So that's how I'm coming in, trying to give everyone an oversight of this. So what is depression? It says, the World Health Organization says 1 in 4 would have or is living with a mental health disorder. We don't call it illness anymore. It's a disorder. It's a difference in pattern. Before you wake up, you shower, you eat breakfast, you're off, you go, you're joyous. Now, you wake up, you're grumpy, you're not joyous, can't even take a shower. So that's a disorder. It's not an illness anymore. It's a disorder. It's a different pattern from which you used to do your routine. So that's what it is. So 1 in 4, we're all gathered here. So 1 in 4, 1 in 4, 1 in 4, 1 in 4. So we're all exposed to mental health disorders. So we say early recognition improves outcome. That's one thing I always beg my patients, please come. At the sight of you're not sleeping, come talk to me. Why are you not sleeping? Because sleep is the most important for us all. And if we know we have all moms with teenagers, I'm in solidarity with you guys, because we know teenagers don't like to sleep, but they need it. However, it's part of growing up for them. So we were going to early recognition improves outcomes, evidence-based interventions that have worked. We're going to talk about it so that we can reduce suffering. Our medications we don't have a magic pill. We're still working on it. However, there's something to kind of elevate the pain and suffering that we'll all go through. Nobody, has experienced some form of either anxiety, either depression, either losing a parent, a fish. We don't have to lose a human being to have grief. You have a best friend that moved out of town. Yes, that person has been someone you've been calling, talking to every day. The person has moved. That is also, you're going to grieve that friendship. You have a fish that you wake up in the morning and you were feeding. Now the fish is upside down. When they say upside down, that means the fish is dead. A mom flushes it in the toilet before you come back from school, right? That is also grief. People grieve differently. So we're going to talk about that too. So evidence-based to reduce suffering. What is depression? Let's talk about the symptoms that people actually feel when they're depressed. Persistent low mood, sadness, anhedonia. What's anhedonia? Don't love what you used to do before. Maybe you're that kind of person that wake up in the morning, you're playing your music to get you going. now you're criticizing the way the person is speaking or singing. Why is that? Why does that sound that way? Why is this thing sound, I don't like that song anymore? So you're not having joy in things that you used to do. Maybe you're the kind of person that likes to take a walk. Now you're like, my joints are hurting, they didn't clear the grass. Why? You're complaining about your neighbors. You're not enjoying what you used to, do before. So I'm just giving a little bit of an example. Fatigue. I always use the word lack of energy, lack of motivation. The fatigue is, even if you sleep for a whole week, you wake up, you still feel tired. That is what fatigue is. You're not having that refreshed sleep, that you wake up and you're like, okay, now I can push a car, let's go. You're not motivated to even take a shower. You're not motivated, because I'm using shower because we see that is the first energy, right? Taking care of ourselves physically. That's the temple of God. Your body is the temple of God. So we're waking up, showering, brushing our teeth, even getting dressed is hard. There's no energy to do anything. That is what depression is. The thoughts of hopelessness. Everyone is like, oh, be hopeful, hope in the Lord, this will go. And you're like, no, Jesus, not today. I've been hoping since the past 10 years. Where is this? Where is the hope going to come from? That is, hopelessness. Seeing things half empty, and everyone is seeing things half full, right? The analogy of a glass. The glass is either half full or half empty, right? So what are you optimistic? And those are the feelings of hopelessness, worthlessness. I'm nothing. I don't feel like anything. I don't belong to anything, And the ultimate that we've seen, 1 in 4, in every second, one person is taking their own life. 1 in every second, and they leave their family member behind. They're taking their own life thinking, I'm a burden, and I'm taking my own life to relieve the stress of my family. However, you're leaving that burden behind on your family that loves you. So that's suicidal ideations of, I'm going to take my life. Is there a plan? There's no plan, but I just feel maybe I'm better off dead. No one is better off dead. We're all better off alive, in support, and working together on this journey called life. Because life will give us ups and downs, and it's the support that we have in an environment like this, that gives us resilience to continue to move forward. So, like I said, 16% of adults in the United States have some form of, mental health disorder. 16%, that's over 50 million people. 50 million. And how many do we have in Jersey? Let's now breaking it down. How many do we have in Essex? Let's start breaking how many do we have? So we don't want to go into that much detail. So that's why we're here. High rates of, comorbidities with anxiety. Some people have they're more anxious than depressed. And some people turn to alcohol. We're in church, yes, we're not supposed to drink alcohol, but our pastor doesn't have a surveillance camera in our homes, so she has no clue what we're doing at home. We're supposed to be perfect Christians, but things happen, Pastor, I'm not breaking it up. So substance use, and also, genetics, we're born with what we're born with, we can't change it. However, we can change our environment, so that we're not triggering what we're already born with, right? Some people are born with diabetes, hypertension. However, they're doing exercise, eating healthy, not to provoke that gene. So changing our environment, our house, if we're, this is America, we buy a lot. There's sale every day. So clutter is our best friend. So we need to declutter. We need to try and live a minimalistic life. Use what we have. Change what we have. If you have that long sleeve shirt, it's summer, cut it into a short sleeve. You don't need to buy an extra, tank top or anything, so we can live on less. So we've talked about the persistent mood, the worthlessness, the suicidal thoughts, and all of those. What are the treatments? What are the treatments? There are medications. I know I said medications. Yes, there are medications. We have days that you can do psychotherapy. Psychotherapy is talking to somebody other than yourself. Psychotherapy is talking to, Pastor is doing a great job, and also talking to someone that is, a professional. Therapy is for everybody. Therapy gives us new insight into ourselves, gives us, an opportunity to see things differently. That is what CBT is, cognitive behavioral therapy, to kind of retrain our brain from looking at the negative to focusing on the hopeful, the positive, because that's the way the brain is. Studies have shown we're only using 10% of our brain as humans. Can you imagine 10%? Can you imagine if we use actually 50? Albert Einstein only used what? 25% of his brain, and he's a genius. So I'm just encouraging us that what we focus on is what our brain is a muscle. We train it to continue to focus on. So let's focus on positivity in the darkness, and that way we're going to train our brain to see things half full instead of half empty, and that's the hopeful. Psychotherapy, untreated, you only have 20% remission. If you see psychotherapy helps you get to like 45-50% with treatment, right? Then we talk about medication, SNRIs, SSRIs, dopamine agonists. We talk about electric convulsive therapy, and that's for the extreme. Those are for people that have tried all different medications, and we do shock therapy. And also exercise. Exercise has been shown to help, mild depression, especially this winter. There's something called seasonal affect depression, because the winter there's no sun. Sun is where we get our vitamin D from and our happy hormones going, right? So a lot of us are moody, teenagers. We're moody, we're grumpy in the morning when we're being woken to go to school, right? But however, we have vitamin D in food, exercise, right? We're eating more leafy greens so that we can get what we're looking for from our meals. So we talk about combining therapy and treatment. That gives you at least 60%, 60%. So there is, I know people are like, oh, why isn't it 100%? I'm in Nigeria. We're in a Nigerian congregation. We're all very smart. I told my kids, I said, we're going to be here. I'm not the only doctor here. We're all doctors in this place, So they're like, why isn't it 100%? I said, because we can take you to 80%, but some things still linger. And this is where faith comes in. The lack of concentration lingers, and the fatigue continue to linger. And that lack of concentration, meditation, that's where you're hearing the word mindfulness. Now you're hearing mindfulness, you're hearing meditation. We're doing yoga. People are like, yoga, does that belong to God? Yoga is just you stretching your body, because PTSD or trauma makes us what? Contract. So when you stretch and release, and release those muscles from contracting, lengthening of those muscles, we're able to kind of let go and heal the body on itself, because they said the body keeps the score. Whatever trauma we go through, for women, it holds us in our pelvics, because that's where we hold life, right? So that's why yoga is important. Meditation is important. We're meditating on the word of God, right? Pastor said it today. All things, he's the greatest physician. I'm just here to relate what he's told me and how he has told me to practice. I'm just a tool in his toolbox, and that's God's toolbox. So that's what I say, meditating on the word, hearing, going back to gospels that pastor has preached. It might not even be pastor's, and it might be somebody else's, and you're hearing that fire in you. you just get up, because there are some days I don't even want to get out of bed. I'm like, it's very nice in my blanket. And by the time I get going and I'm praying and I'm hearing those prayer verses, I get up and I'm going there. I'm like, I needed that. We all need that. So on those days. So meditation on the word helps us get to that 100% of remission when it comes to depression. And I want to beg. African Americans, Black, Asians, studies have shown that when people of that descent are depressed, they go into melancholic depression. Melancholic depression is almost like the person is withering away. The person is withering away. It's like seeing a flower die, bit by bit. So if we catch it immediately, there's a treatment that can, and we're being able to treat it. Instead of go into that dark rabbit hole, we can catch whoever it is real quick, and we can help with medication and, support as a church. That will get you through anything. So we talk about anxiety. Anxiety is one of the most common health conditions globally, and anxiety has shown that, I always say anxiety is good and bad. Good of anxiety is that I woke up yesterday and I got prepared, and my family prepared for today because I was anxious coming on here. I'm like, I'm going to be talking. I'm like, Dr. Adefalo, how many people do you say is in your church? How many people are going to be sitting in front? Blah, blah, blah. That was me anxious. So that is good anxiety. Good anxiety is that I'm going to prepare and I'm going to get to where I'm going so that I am not late. Bad anxiety would have been me stuck at home and you will not have a guest speaker today because I'm trapped in my bed, trapped in my closet, and not willing to be able to participate. So that is bad anxiety. Each and every one of us have anxiety. I always say the person without anxiety is below the ground. So anxiety is good. Excessive fear of the unknown, fear of the future, right? That's part of anxiety. Thoughts of impending doom that, everyone is like, oh, let's go to the beach. Summer is here, we're all going to the beach. And that one person is like, no, 3 people drowned 3 years ago, 4 people drowned 20 years ago. That beach, I'm not going. So that is a bad kind of anxiety. You guys be careful. Don't even go near the water. Don't even look at the water. Those, preparing, okay, just in case, I'm going to be on the lookout. There's a lifeguard. I am my own lifeguard. I'm going to be looking out for everybody. That is the fear of somebody's going to drown. Nobody has drowned in 30 years at that beach. Do you have the lifeguards that are good and making sure that everyone is safe? But that is, thoughts of impending doom. And also ruminating over negative thoughts over and over again. You can't see the positive in anything. So I said that anxiety and depression have they have a dance that they do. Also, you have the social anxiety that coming into a place like this, everyone is, the teenagers have a voice. They get very anxious. Public speaking is not for everybody, but they continue to put themselves out there so that they can also build that skill that they need to be able to, succeed in the outside world. We also talk about panic disorder. Some people are holding on their chest, increased heart rates. I've seen people come into the ED thinking that they're having a heart attack. No, it's just the panic, anxiety that went up a notch. You're sweating, your hands are tingling, difficulty swallowing, we're having heavy breathing. You're thinking that, people from the village, they've caught up. No, they've not caught up. It is just panic disorder. So please, I encourage you, when you have symptoms like this, come to the hospital. There's representation matters, having this and having words for it. That's why I put the symptoms on there. Why? Because many of us were not given the voice, or we're not able to put words into our feelings growing up, So now our children are forcing us to change. They're asking deep questions. We did it because our mothers did it. We did it because our fathers did it. No, this generation, they will put us to the test. They will ask the question. We're going to be ready to answer those questions. We're giving you guys a voice because we didn't have a voice, you have a voice. So ask those questions, teenagers. Don't look at your mom's face or your dad's face. Ask them, are you sweating? Is your hand trembling? Are you having anxiety? Your mom will say, no, I'm not having anxiety in Jesus' name. But mommy, take your medication. Dr. Oti has prescribed it. It was there for a reason. So I'm going to beg you, my fellow Nigerians and my fellow Africans, I'm begging you here that medication is important. Are there side effects? Yes, there are side effects. I'm going to talk about it. GI side effects, maybe first 2 days, some people have diarrhea, and some people don't at all. All those side effects, because we are told to make sure that our patients know side effects of the medication. There's side effects with Tylenol, there's side effects with ibuprofen, but we still take it. So everything has side effects. It's there, but it might not happen to you. But the benefits of the medication outweighs you suffering. So that is what I'm here to talk about. We're still going to use the same medication to treat anxiety. The beauty of psychiatry is that we're using the same medication, the same SSRIs, the same psychotherapy, right? To deep breathing exercise to treat anxiety. So we have deep breathing exercise, mindfulness, relaxation, meditation on the Word of God, yoga on the Word of God. It's playing at the background, and you're doing whatever stretches that you're willing to do. We also have benzodiazepines, which are not our go-to, especially in our elderly, because they accumulate in the system and can cause fogginess of the brain. It has also led to, our elderly adults falling, and that's not, at this age, we don't want to fall because you don't want to break anything else and worsen different, conditions of, not able to work, being in the hospital, losing an income, losing jobs, and all of those. So it just goes down the rabbit hole. So we also talk about addiction in the church. Yes, we're going to talk about addiction. Addiction is a chronic brain disease. It's a chronic brain disease, and those are the things. Loss of control. We're not all perfect. We're not all perfect. I always say to my patients that come in that great grace. We're not giving grace, we're giving great grace. Because with them, it's a chronic cycle. They relapse. Sometimes we say, oh, we're tired. Is it every day we have to go and bail you out? Yes. That is why we're saying great grace. Great grace, unconditional love and support. That is what we give them. There's medication for it. There's rehab for it. There's no stigma. I'm here to debunk the stigma. That's what I'm here for, right? There's treatment, there's rehab, there's AA Anonymous, there's medication to even prevent cravings. Our teenagers are vaping. Yes, they said at 12, one in 10 American child has tried something. So we're all perfect. 1 in 10, has tried something. They've taken that vape from a friend. They've eaten that cookie from a friend because they like to share. Remember, go back to Nigeria when we exchange our breakfast, our lunch in class. Your mom gave you sandwich. I don't like sandwich. Give me your gari, let me drink. So those are those kind of things. So it happens here, but they've tried it. But God's children, because they have God's grace and praying parents, we didn't end up where they will not be found. We found them and we bring them back to church because this is the community for support for them. This is the community where they know that they are all going through the same thing. They are Americans, their parents are Nigerians, and they have to adapt to being Nigerian and American. So that's a lot, right? Am I saying the truth? Some of them are saying, come and talk to my mom at home. I'm coming. So I say that to say most of the common substances that they use is alcohol, cannabis, pain medication that was prescribed to their parents and they never took it, or they took it and left it in the cabinet, so they've all tried stuff like that. So there's no judgment here. I'm here to debunk the stigma. We're going to get through this together. So the next talk I want to talk about is grief. This is near to my heart. Grief, bereavement. I think we all are going to go through this at some point. At some point, we're all going to go through this. What is grief? Grief is a normal response to loss. Loss, like I said, it could be a fish, it could be a tadpole, it could be a frog, it could be a mom, it could be a dad, it could be grandma, it could be great-grandma, it could be a neighbor, it could be anything, but there's grief. Grief is an emotional response, cognitive response, physical reaction. I remember when my mom died, suddenly I was rolling on the floor. I'm like, why am I rolling on the floor? Somebody help me, So that is a physical reaction. There's acute grief, there's prolonged grief disorder. Grief can cause brain stress. It can cause cortisol to go up. Cortisol, the belly gets big, you're eating, because you're like, can I eat this stress away? Food is everybody's best friend, and that I can assure you. We're eating to just undo what just happened, but that is life. We're all going to go through it. How can we go through it? We can say normalizing the reaction that comes with the grief. Like I said, I was rolling on the floor. My husband was holding me. I'm like, please leave me alone. He's like, no, we're in this together. That is the support that, helped me through this. Grief counseling. There's something called grief share. I will talk to your pastor about it. Grief share. It's a worldwide, it's been taking place in churches, in the basements of churches. People come, talk about grief. Grief is a lifetime. I say it's a lifetime thing. It's a lifetime journey. My DSM-5 told me, it says you can grieve for 6 months, and after that is all gone. I'm like, I used to say that to my patients till grief knocked on my own door, and I lost my mom. 6 months later, I lost my dad. I'm like, that is not what we talked about. I thought one person was going to go, and the other one will remain, so that I can, another 7-8 years. God, that was not the plan. And God is like, you and who? I'm taking my people, they've done their work, and they're coming to come and rest with me, right? So there's no time limit to grief. However, we start getting to cope better. If we work. First few months, we lose a loved one. We're crying every day. But in America, you only have 2 days bereavement. If you're working, let me let you know. You only have 2 days of bereavement. And the third day, you're supposed to carry yourself to work. There's a good and bad of that. The good is that you don't want to wallow in it. It gives you an outlet, an escape. The bad is that, oh my God, I'm not physically ready. I'm just going to go to work, but I'm not there. So that is where church comes in. I remember back home, if you lose a loved one, people come to your house and gather. Nobody will let you go. Someone is bringing food. Some people are sleeping on the floor. Some people are even showering you because you don't have that energy. But here we're all busy. But the little anybody can do can help. So we have denial in the first part. I'm like, no, my mom did not die. Please call that number, let me know. I was in America, my mom is in Nigeria. Call, that she will pick up. That is denial. Anger, irritability, Lord, I am angry with you. Why would you take my loved one? I'm not coming to church. You can keep that church. What did religion even do for me? Bargaining with God. God, come down. If you come from heaven down, if you even still exist. We'll continue to bargain and in anger. And God is like, I hear you. I hear it all. He said, give all things, in all things, not in happiness, in all things, give it all joy. right? So that is it. So we have that, we have acceptance. At the end of it, we're accepting of it. That, okay, it's true, mom really suffered. You know, it's true, she was in pain, he was in pain. You know, that fish deserved, I fed it too much. Maybe that's why he died. You know, maybe next time I won't feed it too much. A pinch was really a pinch, you know, so things like that. So we go through different stages of grief at different times. So I'm here to kind of give you the little, I'm not pastor, I'm still a baby in Jesus. So I'm going to give you my little verses that I have. It says, the Lord is close to the brokenhearted and saves those who are crushed in spirit. So the Lord is there. The Lord is my light and my salvation. Whom shall I fear? Nobody. Nothing will I fear. In anxiety, he said, do not be afraid. The future, the past, the present, what is going to come, who our children are going to become. He says, do not be afraid, for I am with you. He said he knew us by the strand of our hair, how many is there. So we as parents were only shepherds to these sheep that God has given us. So our anxiety that they would, meet bad friends, we don't want them to go out there. Our prayers will go with them, because my own mother's prayer got me here where I'm standing. So I'm telling you, and I'm going to say this to our teenagers, take a Bible verse. It doesn't have to be a long one. The day I saw my daughter write Romans 3:8 or something in her basketball shoes, I went to go and look. I said, Google, what does that verse say? Even me, I'm a baby in God. I'm like, what does that verse say? I say, Father, you're doing your work. Go ahead. Because I was brought up thinking that I'm being able to speak in tongues, call on the Holy Spirit. I want to hear my children, talk back to me in the Lord. Until one day, application season, college application season, I'm like, I hope this school will take us. I hope this school will take us. And she was just there looking at me. She said, oh, ye of little faith.
Oh my God.
I'm like, okay. I'm like, God, I'm seeing that revelation. Continue walking. Let me continue sleeping, So that is it. So he said, faith as tiny as a mustard seed. As tiny as a mustard seed. So that little, oh ye of little faith got me. And I'm like, okay, if that's the only Bible verse, go ahead with it. So I want to say, he said, blessed are those who mourn, for they shall be comforted. The Lord is our strength. My parents passed 3 years ago. I had never known grief, but I've cried with my patients every day they come in. Some lost their loved one 10 years ago, and we cried like they died yesterday, because that is grief. We go to the store and I'm like, that shoe will look good on mommy. And in that same instance, my mind reminds me that my mom is not here, my dads are not here. But I'm thankful. I'm thankful for the seed that they implanted in me. So how does faith, seeking treatment and strong support, how can we show up for people? We need to listen to our kids. We need to listen to our neighbors. We need to listen. Listening doesn't mean I'm listening and I'm sharing what happened to me. No, I'm listening so that I can tell you. If all you can do after listening is hugging, that is more than enough, because they say touch is our first love language. Because every one of us, when we were born, we're made to do skin to skin with our children. We're put on us. So that is the first love language that we all know, skin to skin. So that little hug, so that our heartbeats can in sync together, that alone is therapeutic. We say, be kind with our words. Be kind. Be kind. Sister Lola is going through that thing. Did you hear? No, we did not hear, because you are our safe space. Church is our safe space. Our home is our safe space. Whatever anybody shared with us, we are grateful you shared, because you saw us as your safe space. So we hold safe spaces for people. That is what it is. Church is here, working together and carrying each other along and carrying that burden. Only one person cannot lift a bag of rice. We all have to come together and lift it so that it will be lighter. So that is what it is, carrying each other's burden. Asking for help is brave and courageous. Asking for help is brave of you. So we're not going to look down on you. Men, the burden that you carry is the greatest of all burdens. We call you men king. They say, he that wears the crown. Weary is the head that wears the crown. You men carry it so nicely, so eloquently, because I know if women were carrying that burden, we would have been rolling on the floor. So I just want to thank you that the men should seek each other, even if it's in the presence of each other. They don't talk much. I'm married to one where they don't talk much. But gathering in their midst and just watching soccer is more therapeutic than actually talking about what the problem is. So I'm thankful for that. Weeping may stand the night, but as Pastor says, rejoicing comes in the morning. Write the vision. I'm telling my teenagers now, write. I know in your school, in your language, it will be journaling. Journaling is good. Writing it out. I'm not saying journaling and talking about your mommy and your daddy. We're Nigerian parents, so we see bits. So write the vision. Write the vision. Make it plain. They say, though it might linger, wait for it. It will certainly come, and it will not delay. And that is what it is. Thank you so much. Thank you. We thank you.